2 p.m. rolled around, and the weirdest thing kept happening each day. It was like I could feel the medication leave my body, just lift out and fly away, and there was nothing I could do to catch it. So it's confirmed. You have ADHD. You've been through the assessment process, been validated, and now your psychiatrist is writing you a script for a drug you've never heard of that sounds like a party drug from the early 2000s. Then says something along the lines of, "We'll start low and titrate up." You nodded like you knew what that meant. You did not know what that meant. I definitely didn't. My little ADHD brain instantly went to similar sounding names of old Roman emperors, Tiberius, and then somehow to Turkey and tryptophan. So I didn't really clock what he was saying when he was actually explaining what titrate up meant. So I finished my telehealth appointment and immediately Googled everything he told me, which is a completely normal response to being given a script for a controlled substance you've never heard of before. Oh, and I also called my mum, because she can't usually get through the day without 3 or 4 calls of me asking mundane questions that a grown-ass woman should already know the answer to. I still don't know how to get an oil stain out of a white shirt. Anyway, this is Anyway, I Have ADHD, a podcast for people whose brains work on a different operating system and nobody gave them the manual. I'm Han, late diagnosed ADHD, mum of 2, founder of NeuroSpice Nation, and still slightly confused by the fact that nobody noticed for 31 years. Not one person. It's almost like they've never met me. Every week we pick apart a different corner of ADHD life. The stuff that's funny now, but wasn't at the time. The stuff that's still not funny. And the stuff that's actually useful. No shame. No hustle, no wellness bro energy, just chaos, warm chaos, with takeaways and hopefully you feeling slightly less alone or crazy. Today we're talking drugs, what's actually available for ADHD in Australia, how they work, what the process of actually continuing to get the drugs looks like so you can continue to function like a normal human being, and why the whole system feels like it was designed by someone who has never even met a person with ADHD. Anyway, let's get into it. Here's what happened for me. We went straight to Vyvanse as the drug of choice. I didn't want something short-acting. I could barely remember to take my birth control pills as it was, so I knew deep in my core that having to remember ADHD meds throughout the day wasn't going to happen. And if I wasn't taking them as prescribed, I just wasted all that money getting assessed and diagnosed. As we've established in the first couple of episodes, my memory is shocking. Thanks, ADHD. What I can remember is that my psychiatrist started me on a very low dose. I think it was around 20 milligrams. Looking back from where I'm sitting now, at 60 milligrams, that seems pretty conservative. But that's completely normal when you're starting out. So here's how I remember it happening once I took that first pill. About an hour after I took it, that's how long it takes for me to feel the effects, but everyone's different. I swear it was like I had clarity inside my head for the first time in my whole life, like my poor little brain was sitting inside an echoey hallway shouting, "Hello? Hello? Hello?" confused about where all its chattering friends had suddenly disappeared to. I felt like before I was under the ocean, and it was just background noise cluttering everything. But now I had silence. And I didn't realize until that moment that I'd never had silence before. All my thoughts were still there, the running lists, the random creative ideas, that dread feeling about something I said at a party in high school resurfacing now to embarrass me 15 years later. But I could actually hear all of it. It wasn't muffled. It was just there. I was no longer picking up a random bit of a song heard in passing and running it through my head for 4 hours straight. I was no longer narrating my day like I was the star of my own internal telenovela. Now I'm walking up the stairs, opening the fridge, feeding the dog, then I will go and sit down. The medication didn't propel me forward like a motor. It removed what was holding me back. Then 2 p.m. rolled around, and the weirdest thing kept happening each day. It was like I could feel the medication leave my body, just lift out and fly away, and there was nothing I could do to catch it. My kids would get home, there'd be too many overlapping sounds, my husband would just continue to exist in the exact spot in the kitchen that I wanted to be, and my fuse would go. I was cranky, I missed the clarity, and because I now knew what the other side felt like, I was resentful of everything and everyone that was proving I couldn't cope. My agitation was worse, my fuse was shorter, and I did not want to do any of what needed to be done. Parenting, homework, dinner, bath, bedtime. All of it requires patience and executive function. And after 2 p.m, when Vyvanse had smoke-bombed right out of my brain without so much as a backward glance, I had none of either. So I booked another appointment with my psychiatrist. It felt urgent, but there was a wait, as there always is. That's normal. Don't panic if you hit the same snag. He had an easy solution. A low dose of dexamfetamine as an afternoon top-up, which is a really common approach that I absolutely did not think to Google while I was spiraling at 6 p.m. with 2 kids and a dog crawling all over my touched-out self. Vyvanse for the long-acting coverage throughout the day, a small hit of dex in the afternoon to get you through to bedtime. The meds weren't failing me, they just needed fine-tuning. I also ran into sleep issues. Stimulants and sleep don't always love each other, but for me it was almost a rebound effect. My brain had been leashed all day, and once the dex wore off and it got quiet at bedtime, it invited all its friends over for a rave. I could fall asleep fine, but a couple of hours later my brain had apparently decided that the night was young. My psychiatrist then suggested clonidine for sleep. It didn't work for me, so I didn't persist. You can do that. You're allowed to try something, decide it's not working, and stop. By that stage, my medicine cupboard was looking like a small pharmacy, so dropping something that wasn't helping felt like the right call. What did help for sleep was giving myself time to unwind before bed, getting off my laptop and forcing myself to stop working at least an hour before lights out, and occasionally a very small amount of rest of it if my brain was feeling particularly feral. That's just an over-the-counter sleep aid, nothing fancy. We'll talk more about strategies like that in later episodes. Then about a year in, the rules changed. The maximum dosage limit was increased, which meant my psychiatrist could take me high without needing to send me for a second psychiatric opinion first, which I did not have the time or money for. So he bumped me up to 60 milligrams of Vyvanse, taken at 6 a.m. to give me an hour to kick in before I had to parent, plus the 2 p.m. dexamphetamine top-up to get me through the evening as a calm, stable, functional human being. That combination works for me right now, but bodies change. Hormones change, especially as a woman, because apparently nothing can be straightforward for us. Life changes, brains change. I know this won't be right forever, but that's the thing. You can work with your psychiatrist as you change. You don't have to white-knuckle the same medication when you know it's not working anymore. What I want you to take from this little personal rant is not my specific doses or my specific medications. It's that it took time, it took adjustments, it took patience from me and from the people around me as I worked through it. I won't lie, it took around a year to get to a point where I felt stable. That's normal. It might feel unhinged while you're in it, but you will get there. Now let's talk drugs. Actual drugs. Pharmacy drugs. Next week we'll get into the more natural and lifestyle stuff, but today we're staying firmly in the land of things your psychiatrist can prescribe you. There are 2 main categories of ADHD medication in Australia: stimulants and non-stimulants. Most people start with stimulants. That's not a personal judgment. That's just what evidence says works best for most ADHD brains, and it's what Australian guidelines recommend first. Let's break them down properly, starting with the stimulants. First up, methylphenidate, Ritalin, Concerta, and friends. This is often where people start, and it's been around since the 1940s, so there's genuinely a lot of research behind it. It works by blocking dopamine and norepinephrine by being reabsorbed back into your nerve cells after they've been released, which means those chemicals hang around longer and build up to higher levels between your neurons. Dopamine is the one you've probably heard of. It's involved in motivation, reward, and focus. Norepinephrine is its mate that helps with alertness and attention. For an ADHD brain that's been chronically low on both, this is kind of a big deal. It comes in short-acting and long-acting versions. Short-acting kicks in fast but wears off in 3 to 5 hours, useful for targeted coverage. Long-acting versions like Concerta are designed to get you through the day without a lunchtime dose. Side effects to know about are reduced appetite and weight loss, trouble sleeping, and small increases in heart rate and blood pressure. Those are the most common. Headaches and stomach aches are also pretty normal, especially when you first start. Most of these will settle as your body adjusts, but if they don't, that's a conversation for you and your prescriber, not something to power through. Next up, dexamphetamine, aka Dex or Dexies. It's amphetamine-based, which I know sounds alarming. I know, but stick with me. Dexamphetamine has been around since the 1930s. At therapeutic doses for an ADHD brain, it works by increasing dopamine and norepinephrine. Same outcome as methylphenidate, slightly better mechanism. It's short-acting, which is why it works well as an afternoon top-up rather than a primary all-day medication. It hits faster and leaves faster. Side effects are similar to methylphenidate. Appetite suppression, sleep disruption, increased heart rate. The faster onset does mean the come-down can feel more noticeable, which is part of why it's often paired with a longer-acting medication rather than used on its own all day. And finally, lisdexamfetamine, otherwise known as Vyvanse, my personal favourite as you know. Also amphetamine-based, but this one's clever. Vyvanse is a prodrug, meaning it's actually inactive when you swallow it. Once it hits your bloodstream, your red blood cells convert it into active dexamphetamine. That conversion process is gradual and consistent, which means you get a smoother onset, more consistent symptom control throughout the day, up to 14 hours, and a lower potential for misuse compared to immediate release stimulants. That's why the crash tends to be more gentle. It's not a cliff edge, it's more of a slow fade. For some people, and for me, as we've established, it was a very defined 2 p.m. smoke bomb situation, but everyone's different. Common side effects include decreased appetite, dry mouth, and insomnia. Anxiety can also show up, especially at higher doses or if you're sensitive to stimulants. It's worth knowing that it's also approved for moderate to severe binge eating disorder, which is interesting context given the known relationship between ADHD and disordered eating. but that's a whole other episode. All three of these are on the PBS. If you've got Medicare, you're paying a capped amount, currently around $25 per script as a general patient, or $7.70 as a concession card holder. There's also a safety net that kicks in once you've spent enough on the PBS scripts in a calendar year, which drops the cost even further. The system is annoying to navigate, but once you're in it, the medication itself doesn't have to be financially out of reach. Now, if stimulants don't work for you, side effects, health reasons, personal preference, or they just don't do the job, there are non-stimulant alternatives, and we're going to talk about 3. First one to mention is atomoxetine, sometimes called APO atomoxetine. This is a non-stimulant, which means it doesn't work the same way as the amphetamine-based medications at all. It's a selective norepinephrine reuptake inhibitor. It works by increasing norepinephrine levels specifically, rather than dopamine. Think of it as a more targeted approach. The big trade-off is that it takes 4 to 6 weeks to reach full effectiveness, so it requires patience during the initial treatment period. You're not going to feel it in the first morning like you might with a stimulant. It builds gradually. For some people, that's actually a positive. No noticeable peak and crash. For others, it's frustrating. Side effects are different to stimulants too. Nausea, stomach pain, decreased appetite, fatigue, and dizziness are the more common ones. Generally, not the same sleep disruption issues, which can make it a better fit for some people. Because it's not a controlled substance, the prescribing rules around it are also a bit more flexible than Schedule 8 stimulants. Then you've got clonidine. And here's the fun fact that nobody tells you. Clonidine is actually a blood pressure medication. That's what it was invented for in the 1970s. It was first developed to treat high blood pressure. It works by activating certain receptors in the brain that reduce your heart rate and relax your blood vessels. So why is it on this list? Because that same calming mechanism turns out to be useful for ADHD, particularly for hyperactivity, impulsivity, and sleep. By reducing norepinephrine release, it can lead to sedation, reduce blood pressure, improve sleep initiation, and calming of emotional dysregulation. It's used in a couple of ways. Sometimes alongside a stimulant to take the edge off side effects like sleep disruption, which is why my psychiatrist suggested it for me, and sometimes as a standalone option for people who can't take stimulants. Here's something extremely important to know. One of the biggest risks with clonidine is stopping it suddenly, which can cause dangerous spikes in blood pressure. It's not something you can casually drop. If it's not working for you, as it wasn't for me, talk to your prescriber about how you can come off it properly rather than just stopping. The last one for today is guanfacine, brand name Intuitive. Same family as clonidine, also originally a blood pressure medication, also works by calming down the brain's stress signals rather than speeding anything up. Think of it as gently dialing down over-arousal in the prefrontal cortex, the part of your brain responsible for focus, planning, and pausing before you do something impulsive. Rather than speeding anything up the way stimulants do, it just takes the noise down a notch. It's not a controlled substance, so it has a lower risk of misuse and dependence than stimulant medications. It also doesn't suppress appetite or cause the sleep disruption that stimulants can, which makes it a useful option when those side effects are a deal breaker. It's used in a couple of ways. As a standalone when stimulants aren't suitable or haven't worked, or as an add-on alongside a stimulant to help cover the gaps, particularly around hyperactivity, emotional dysregulation, and sleep. Benefits tend to build over 2 to 6 weeks, so it's not an overnight fix. But the effects can be pretty consistent once they kick in. The most common side effects are sleepiness, constipation, dry mouth, and low blood pressure. The sleepiness is real, especially when you first start. Most people take it in the evening for that reason. One important Australian-specific note. On the PBS, Intuitive is currently listed for children and adolescents aged 6 to 17. For adults, it can still be prescribed, but it's off-label, meaning a prescriber can use it based on their clinical judgment, but you won't get the PBS subsidy for it. Worth asking your psychiatrist if stimulants haven't been the right fit. And the same for clonidine. Don't stop it suddenly. Taper down with your prescriber. Now here's the bit nobody tells you. These medications don't work the same for everyone. What your friend takes or what someone on TikTok swears by might do absolutely nothing for you, or do something completely unexpected. Finding the right medication at the right dose can take time. Multiple appointments, adjustments, going back and saying this just isn't right yet. That's not a failure. That's just how brain chemistry works. Okay, that was a lot. And I say that as someone who just talked to you about blood pressure medications and pro-drugs for 20 minutes. So I appreciate you staying with me if you're still here. Here's what I actually want you to walk away with. Medication is one tool, a really useful one for a lot of people, myself very much included, but it's not a cure. It's not magic, and it is absolutely not a straight line. I describe it more as one of those roadside sobriety tests where you have to walk in a straight line. It doesn't end up that way, even if at the time you're completely convinced you're nailing it. It takes time, it takes adjustments, and that's a completely normal part of the process. Not a sign that you're broken or that it's not working. And if you're still in the waiting room phase, still trying to get a diagnosis, still waiting on an appointment, still staring at a script you just picked up, can't pronounce, are slightly scared of, and have no idea what to do with, I see you. That bit is hard. The other side exists, I promise. A quick but important disclaimer before I let you go. I am not a doctor, a pharmacist, or anything remotely resembling a medical professional. Everything I've shared today is based on my own experience and stuff I've researched. Not a medical degree I definitely don't have. None of this is medical advice. Please talk to your GP, psychiatrist, or prescriber about what's actually right for you and your brain. And if you're struggling right now, not just with the medication stuff, but with any of it, Lifeline is available 24 hours a day, 7 days a week. You can call them on 131114. It's free, it's confidential, and they're there exactly for this. Next week, we're getting into the stuff that nobody puts in a pamphlet, the non-medication approaches. Things like sleep, movement, food, environment, maybe some crystal healing energy. Just kidding. Only evidence-based stuff here. And none of it is, have you tried a bullet journal? Spoiler, I have. It did not go well. We will discuss. Anyway, I have ADHD. And if you're here, you probably do too. You're not broken, you're just a lot. New episodes every Wednesday. Follow the show so you don't miss one. And if you forget to follow and then forget the show exists entirely, no judgment. That's why I'm also on Instagram and TikTok at NeuroSpice Nation. Come find me, send me a DM, tell me your diagnosis story. I genuinely want to hear it. It's not just something I say. If today's episode helped even a little, a rating or review goes a long way. It's how other spicy brains find the show, and frankly, my ego could use it. See you next week.